You're watching CT22 with Eric Parker, sponsored by Hartford Healthcare.
Welcome back. When you call 911 in a medical emergency, you want to know that EMTs and paramedics will get to you quickly. But a shortage of EMS volunteers in Connecticut and around the country is creating challenges that cities and towns are having to address. Here to talk about those challenges and what's being done about them is Rafaela Kohler. She goes by Ralph, and she's the Director of Emergency Medical Services for the state of Connecticut. Ralph, thanks for being with us. I appreciate it. Tell us about this problem because it's a big one.
Yeah, thank you for having me. I think it's multifaceted. Part of the reason for the EMS workforce shortage is there is a decline of number of volunteers, and that doesn't help to replace the longtime volunteers that are aging into retirement. The second is low wages for EMT and paramedics, despite the tremendous responsibility that comes with that job. There's also a very limited capacity to raise the wages due to the declining financial health and negative fiscal outlook that are facing most of our states and the nation. And there's also a greater need for more EMS responders to be able to meet the increasing demands for EMS due to the aging communities, the drug and alcohol disorders, the behavioral health challenges, and chronic health care needs. So I think it's multifaceted. Retention and recruitment seem to be the two top things that we look at repeatedly.
Well, you look at just what you said there. There's more need. There's fewer volunteers. It's tougher to pay people what they need to do the job professionally. So let's start with the volunteer piece of it. I know reading some of this stuff, it was COVID that led to some of it. It was aging out of some of the volunteers. I know a lot of the smaller cities and towns really rely on those volunteers when someone calls 911. So let's talk about that first. How do you address that part of the problem?
Well, I think that part of the problem is that stressors of the job have become more acute with this year. But people did question whether they wanted to do the work and put themselves in the front line and bring the virus to their family. I mean, I think that is a legitimate question that they asked themselves and the answer was no, I don't want to bring this to my family. So I'm not going to be able to volunteer the hours that I was previously. We want to bring in new volunteers, but again, the number of people that are there to volunteer just aren't stepping up. I mean, the value of providing services to your neighbor and your community is a self-value that you have to look at. And so that's important. The other thing is that I don't think that most of the public understand the EMS service. They know that they dial 911 and they know that someone shows up, like you stated before, but they don't have an understanding of how fragile the system is and what the needs of the system really are. Connecticut is a primarily volunteer service, so we rely heavily on the volunteers to do that. It has commercial services, it has municipal services, it has fire EMS. The other part that we are finding really difficult is that it's a stepping stone. People come into EMS, but then they go on to different careers. They go on to become a nurse, they go on to become a firefighter, a police officer. They get the skills that they need that are problem solving, quick thinkers, but they're not getting the adequate salary that is commensurate with that. And so they look on to other things to be able to make that, financial for their family.
Well, and certainly the cost is there. I mean, I know, thank goodness, there are people answering these calls and coming out and responding during an emergency. But obviously, towns have to be prepared to make sure someone's there. I saw a great article in the Hartford Courant just last week, Jesse Leavenworth writing about Vernon. They needed to hire eight EMTs because of the decline in volunteers. That was a $687,000 price tag to bring those people in. So I'm sure a lot of mayors and first selectmen and other people are worried about these numbers, the decline in volunteers, having to hire people, having to pay more to keep them. It's a big issue that needs to be addressed.
Yeah, the result of that is that EMS has become largely a local responsibility. It's heavily dependent on Medicare and Medicaid and private insurance reimbursement, as well as sometimes subsidized by fundraising efforts, donated labor, and sometimes local tax revenues. But that funding is always not where it should be. A while back in the 60s and 70s, we had great enthusiasm for the federal funding of EMS, but now in the 1980s and 90s and 2000s, that modest federal environment and involvement in EMS has largely decreased. And so that's why it's become largely a local responsibility. We are a small office in the Department of Transportation, and we have not enough representation for our Congress to have to look at us and recognize us as another branch of public safety.
Well, I know there's been a lot of efforts to try to change this. The American Ambulance Association wrote a letter to Congress asking them to take a national look at it. One of the things they cited was 20 to 30% annual turnover in paid EMTs. That means every 4 years you're replacing the whole staff, if that's kind of how the numbers roll. So we have about a minute left. Ralph, tell us if there was one change, if there's one thing that our viewers could maybe hear from this interview. What do you want to see happen? What needs to change? We have a minute.
I think what needs to change is the funding to our EMS services. We have to look at that. We have to look at that carefully, whether it be your local services or local communities or Congress. That has to change. The salary inequity is not a surprise of why most EMS personnel leave their job, and that having to work more than one job to make ends meet shouldn't be the rule. It should be an exception, and it's the rule for these people, and they work very hard, give a lot of themselves, and I think they're not recognized as they should be.
Well, and certainly as someone who's covered a lot of breaking news stories out in the field, you go to the scene of some kind of emergency, you look around and just see the sheer number of people who just showed up to help because someone called for help. It's certainly an important service. We appreciate you sharing that message with us. Rafaela Kohler, the director of the Office of Emergency Medical Services, thanks for being with us here on CT22.
Thank you for having me. Good luck.